Good morning, everyone. I'm Michael Magrath. I'm Business Development Director at Gemalto. Gemalto may be a company that you aren't familiar with like the other sponsors. We're actually a $2.5 billion global company with about 1 billion end users of our products around the world, which represents about 20% of the population. Good chance you're carrying at least one of our products on your person right now. We do things like the electronic passports that are being issued by the U.S. Gemalto is one of the suppliers of those covers that have a chip in them. We do the SIM cards in your cell phone for most of the major cell phone companies around the world. Bank cards in your wallet, transit cards to ride the metros, and identity cards that are used by corporations, health plans around the world, national programs, national ID programs, not here in the US, of course. The technology that this is based on is smart card technology, which is privacy-enhancing technology in this healthcare world is can serve the needs of patients, providers, and suppliers. Where these cards are being issued in a lot of the hospitals around the country, they're used for providers and staff for high assurance that they are who they say they are when they walk in the building or log into a network. They are used being issued to patients for patient registration, streamlining claims, making an impact on medical identity theft and fraud, waste, and abuse. There are 3 states right now that are discussing issuing smart cards as Medicaid cards to combat fraud, waste, and abuse. New York, Georgia, or North Carolina. There are rumblings around this hill about doing pilots for smart cards for the Medicare system. Medicare, as we know, has about $60 billion in fraud every year. That fraud comes from some of rogue providers, could come from, a lot of it comes from rogue suppliers. People filing false claims to Medicare. They may, on the provider side, it may be organized crime, stealing and compromising a physician's provider ID number. So the smart card technology can provide very high assurance that that person is who they say they are when they are writing a prescription electronically to satisfy DEA, or filing a claim to a health plan, whether it's Medicare or private insurer. So I just want to give a quick introduction on what we are and what the technology is, and I'm really here to introduce our moderator for the next panel, which is the future of health IT. Bill Pierce is Senior VP at APCO Worldwide. He's also an adjunct professor at Johns Hopkins, and prior to joining APCO, he served as Deputy Assistant Secretary for Public Affairs at DHS. And Bill's bio is in your packet, so I won't go into too much detail for time's sake. But all yours, Bill.
Great. Thanks